Just follow up very quickly on the question. Are there incentives if you live healthier? Yes and no. There is language that designs wellness programs within insurance that if you stop smoking or you lose weight or you do certain healthier things, you get dollars knocked off of your premium and off of your copayment. So they're there, but what has to happen is you have to create legislation to kind of make those things real. And a state legislation. So federal legislation happened. You need to create state legislation to actually implement it here in the state. And the way that some of the bills have been designed to do that actually hurt our populations because we don't necessarily have access to the gyms or the smoking cessation programs or what have you. So we have to be careful to the point we have to watch how they're designed. There are incentives, but we have to make sure that they don't actually harm us. We have a ways to go to get healthy and to have that access. So we just have to watch how things are designed.
Well, I was feeling a little guilty that we've gone over, but actually we were late starting, so I don't feel guilty anymore. So I will just keep going and ask one last thing, and that is about clinics. We were told that clinics were going to be very important in all of this. Who here knows what is happening in terms of clinics and what role they will play in the healthcare system of the future?
Well, I can speak a little bit to some of the clinics that we have here. There's the Bayview Health Clinic that is in the process of an expansion and expansion in services as well as enlarging the building. There's a clinic by the Bay, which is a brand new clinic that opened 3 years ago. It's a free clinic. Whether you're documented or undocumented, you can get free service there. That's in the Excelsior. It's on Mission Street, Clinic by the Bay. Also, put a plug in 2015, there'll be a bond measure on the ballot. Hopefully voters will pass this bond measure and would help us with the expansion of other health clinics. So the Southeast neighborhood directly will be benefiting from that, as well as the clinic in Potrero Hill. And then there's NIMS is a clinic on San Bruno Avenue and Visitation Valley that is also serving largely the Spanish-speaking population.
So we have, our system is integrated, as we're saying. So there are community-based clinics like a Southeast Health Clinic near here, Potrero Hill Clinic, a Mission Neighborhood Health Clinic, the Northeast Health Clinic, and all these clinics basically provide excellent care on their own. And then what happens is they refer them in to the hospital. So there's an integrated delivery system where people are seen in the clinic system, and then they basically come to our facility to get quaternary, tertiary care as they need to get, or sometimes high-end cardiology care or OB or what have you. So there are different layers of care, and that's what the integrated system means, is that there are all these clinics that then feed into the main hospital system that then, so people can get their care when they need to.
Peter, go ahead.
She looks like she's jumping.
I'm sorry.
Did you hear anything I said, or no?
Bring it
I did.
Oh, sorry.
So what I said is that there are a number of clinics in the public health department that feed into the main hospital system. Did you hear me now? Can you hear me now? Very good.
And all of the primary clinics in San Francisco that receive funding from the San Francisco Department of Public Health are responsible for what we were talking about, which is that integrated care delivery system, which is going to include cultural competency. There's a lot more competitiveness in terms of how well you treat patients and what the outcomes are, if you can have healthy outcomes, the metrics. So all of these things will be clearly defined as well as monitored in terms of how they impact community health overall.
California, I'm sorry.
Okay, quickly.
California has the largest clinic system in the country, and we've received the most dollars from the federal government to bolster and strengthen and open new clinics. They serve a critical piece in all of this to the health home so that everyone's getting all of that care. There's amazing work that's happening in our clinic system, but they are all doing the work to make sure that they are the provider of choice. A lot of times people only go to the clinic because it's their last resort if they're not going to the ER. So we're doing a lot of work to make sure they are culturally competent, they're reflective of who's coming in the doors, so they're going to be absolutely critical.
Okay. Well, Peter, you have really taken us, recorded, documented excellently the starting point for all of this. No one will ever be able to say if there are improvements, if there weren't improvements, because you've got it all right there on video, film, and whatever. having traveled across the country, but living in the little shell that we're in San Francisco, tell us what you think the rest of America is thinking about this bill as it's about to go into effect in a very short time now.
My mic is dead. Well, I think people have a lot of questions, but I think primarily at the core of why we made the film, when we recognize the political context that the film would be released in, and we also recognize that policy, public policy, is influenced by advocates. I mean, it's just a reality. And I'm watching House of Cards right now, which is quite good. Have you seen it? So you really get in there, the political machine, and see how that operates. And for those on the stage who are in that, you understand that policy is influenced by advocates, and the people in this film, people in waiting rooms all over this country, don't have a method to advocate for themselves, for their humanity. And so we believe that my role as a storyteller is to provide them a way to do that. And so now we have a tool, so that this film is a tool, and people are responding to the humanity of this film in a way that's been quite profound. You know, how they feel about the Affordable Care Act, I think they're in the same boat that we all are in, which is lots of questions and some anxiety. And depending on your station in life, there's more or less anxiety. But the reality is that there's nothing guaranteed in this life, and that was part of one of the big themes of this film, is that we could all find ourselves in that waiting room, or we have a loved one that's in that waiting room, or we have a neighbor or a friend or you know, someone that's close to us, and that's why we made the film. And we're hoping that as, you know, we approach this marker, this somewhat arbitrary marker of when it begins to be implemented, that we need to keep our eye on the ball in terms of telling the story in 3 dimensions of our communities. And that healthcare, it's not just healthcare, it's access to education, it's criminal justice, it's all these things where I think our communities have been represented in a 2-dimensional way, and that has created a problem of empathy amongst our communities themselves, people who could advocate for these communities, that these are human beings, and the more we tell their story, the more we can empathize, and the more we can make a difference. And so that's what we're hoping we can do with this film. I just want to add, there's another film I was tangentially involved in. My good friend Ryan Coogler directed a film called Fruitvale Station, which is about to come out, which is about Oscar Grant, the death of Oscar Grant, who was born and died at Highland Hospital. And this is a story that also is going to tell the story of our communities in 3 dimensions for the first time, in a space that is typically reserved for films that do not do this, or not made by filmmakers who have lived that experience. And Ryan is Oscar. And I recommend everyone to get ready for that film to come out, because it's going to shake some trees.
Thank you, Peter. When people ask me about the direction of the media, I used to sing a song of sadness. But as we have been cluttered with more and more trans media, I mean, I'm not sure all of the terminologies, the new terminologies that people are using for whatever media is supposed to be today, it is so good to know that right here, homegrown, there are filmmakers dedicated to telling the truth. And Peter's not the only one, but he happens to be one of the best. And that should make us feel good. We are a nurturing community that have given them a place to be, and they've been smart enough to go out and find the money and make it happen. So that's good. But in addition to that, when I first started as a reporter back in the late 60s, there were a group of women in this part of the world called the Bayview Hunters Point. They were called the 5 Queens. They were led by a woman named Eloise Westbrook. They didn't wait on anybody to give them permission to do anything. They organized, they picketed, they protested, they went to Washington, they called out the president, they did whatever it took. Your health is worth all of those actions. We hope we've given you some information, or that at least raised your curiosity enough that you will feel that it's worth your time to learn how to avoid being in a waiting room like the one that we just witnessed. So I'm going to call on, in addition to all these leaders, and I want you to take the programs home with you, because their resume and their names and their organizations are there. That's the way you could follow up. But I'm going to call on our leader of the San Francisco Lynx now to come and do our wrap-up for the program. pardon me, and to let you know how much we appreciate your presence here today. So thanks to the panel. My thanks to all of you. You were wonderful.